Welcome back to Visions for Health. I'm Wendy Trubo, COO and co-founder of Visions Healthcare, and my guest today is Andrali Horn, who specializes in biodynamic craniosacral therapy as well as deep tissue massage. Welcome.
Welcome. Thank you.
Thanks for being here.
I'm excited. I'm totally excited.
So talk to me. Were you always a massage person, or did you have another career before that?
Well, growing up, I did theater. I've always had a passion for being in front of people and helping people, and so doing theater allowed me to do that. I started when I was about 5 years old and went all the way till I was about 25 and got a degree in technical theater, with stage management and doing backstage work. So that lasted for a while, and then I decided I was tired of it and I wanted to do something, I would say, more meaningful with my life. And I'd always did massage to other people in the theaters. We'd always line up or whatever and massage each other, and I thought I was pretty good at it. And so that was always in the back of my mind, that I wanted to become a massage therapist. I even thought about it when I was I went to one of my deans and was talking with them about, I really want to do massage. And so...
And they said, no, go to a reliable career like,
yeah,
like theater?
Yeah, that was it. No, so, after I had been doing it for a while and got out of the theater, I decided that I wanted to, like I said, go and become a massage therapist. I had no idea how I was going to do it, but I did find a school in Florida that I really, really liked, and went to the Florida School of Massage.
Okay. So is this something you lived at, or you
no,
took on the side? Or?
It was a 700-hour course that I did. Me and my wife at the time, we moved to Florida, and after truck driving to pay for massage school, we said we wanted to move to Florida, and that's how I paid for massage school. So Noelle and I went, and I did the regular program, and then I did the sports massage program. And
is that more than the 700 hours?
Yes, it was in addition. It was another 250 hours.
Okay.
And after that, I did the structural integration program, which was another 250 hours. And
so this is a whole year.
This was
right?
This was over a 2-year period of time.
Okay.
And after that, I decided that I wanted to teach, because I thought I was doing well enough, and I told Noelle that I really wanted to teach, and I got invited to do the teacher training program at the massage school, and I started teaching the musculoskeletal part of the program.
Okay. Now this is deep tissue or sports, or a combination?
It was the anatomy of the body. So I was teaching all of the musculoskeletal anatomy. And as a practitioner now, and I look back on it, I say by being able to teach, or being a teacher, it allowed me to be a better therapist, or better practitioner, of knowing what's underneath the skin.
Well, right. You're not just wailing away. It's targeted.
Yes. When I was teaching at the massage school, we had a program where I could take the students to a community college, and they had cadavers. And for 3 years, I got to take my students, and we viewed cadavers. Not only did I get to view, but I also got to go in anytime I wanted by myself and just look at these cadavers, and it really, really allowed me to start to see what's under my hands while I'm massaging people, and I really enjoyed doing the massage. But after a while, I couldn't. If someone came in with an issue and I could not get them better, I started searching for something else that I could do. And
can I ask you about that? When you say you couldn't get them better, what would you notice in their treatment that you felt you were stopped by?
Well, what I noticed was, say they came in with a shoulder issue, and I'd given them 1 or 2 treatments, or maybe 3 or 4 treatments, and that shoulder issue hadn't resolved. I'm like, there has to be something else that I'm missing that's not allowing that shoulder to get better. And
This is an acute injury, or this is any kind? So is
Any-
there a
any-
difference between acute and chronic?
to me, yes, an acute injury, knowing what I know now, it's a lot easier to treat someone that has an acute injury. If it's a chronic injury, it may take a little bit longer because it's settled in the system a lot more. So mostly what I would say is, if I was treating someone that had a chronic issue or a shoulder injury that's been there for a while, it seemed like just doing the tissue work would not allow it to get better. I needed something else, and that's when the owner of the massage school mentioned craniosacral therapy to me, and when he mentioned it to me, I was like, wow, I think this is what I really want to pursue.
Clunk.
It shifted.
Yeah.
Something shifted in me, and so I took a Craniosacral 1 through the Upledger Institute, and I really fell in love with the work. And yet I'd also been researching this other guy, Michael Shea, and when I researched him, I said, this is who I want to train with because of his philosophy around the work. And so I did a 500-hour course with him, which was over a 2-year period of time, where we'd take one course for 5 days, and then 3 months later we'd take another course, and 3 months over a couple of years.
And I think everybody in the audience might know what is deep tissue massage, but what is craniosacral therapy? How does it work?
Good question.
I know, right?
After practicing for 15 years, I'm still trying to figure out exactly what it is, because it's a felt sense. When I put my hands on someone, I'm starting to sense what's going on in their tissues, in their bones, in their fluids of the body. So to be able to describe that, it may be different for each person that I put my hands on. So giving a typical definition of craniosacral therapy, it changes, and it changes as a practitioner learns more about this work. My definition of cranial work when I first started is totally different than my definition of cranial work these days. And so you're still wanting a definition.
Well, I think something to guide our listeners.
Okay, something from what I understand now and how I treat. It's about being able to put my hands on the body and sense those embryological or those developmental forces of growth that the embryo went through, and those same embryological forces are carried through time to become the healing forces in the adult. So when I put my hands on someone's body, I'm trying to find that which does not know disease, that which is completely healthy, underneath the surgeries, underneath the trauma, underneath the birth issues that we all may have.
So the base philosophy is the body wants to be in balance.
Yes.
And then you're searching underneath the disease for the balance.
Yes.
So where do you put your hands on someone? Is it their head, their shoulders, their feet? What actually happens?
Well, at this point, I say the health is in the whole body. And so I may put my hands on the head, or I may start at the feet, or I may start on the side of the body, or I may treat from the tailbone. Because when I put my hands on that body, I'm trying to sense the whole of their body, whether or not they have a neck injury or a knee injury. When I put my hands, I'm trying to sense the wholeness of that whole body. It's not about the injury or to the knee or to the neck. It's about what is this whole body doing to manage that knee injury? What is this whole body doing to bring itself back to its balance? And so to be able to put my hands on and start to sense those embryological movements that are still present in the body, they give me clues as to whether or not this body is healthy or how long it may take this body to get healthy. And yes,
I got some questions.
you go ahead.
When you say embryological sense, you're talking about the way the body developed when we were inside our mothers.
Yes, yes,
Our biological mothers.
yes, yes. And those same forces are, I would say, you got to remember that embryo, or we came from one single fluid-filled cell, and those fluid dynamics or fluid motions that created that embryo are still present in the body. And to be able to sense those fluid motions, you are sensing what we call the part of the health. We are sensing the health in the body.
Where does this live in the body?
Where in the body? That's a good question.
I mean, because
To me, every cell knows, every cell has that health because it all came from that one single cell. So if I say, where does it live? It lives in the whole body. So that's where when I put my hands on the body, I'm trying to sense the wholeness of this person because it has the totality of that original embryological health.
so is this something that you're born being good at, or is it something you develop, or do you have to start with some level of ability and then hone it?
I think it's in all of us. Well, I do believe that, but I think what happens is we lose our relationship to the natural world, or we don't spend as much time in stillness. And the more I spend in stillness, or the more I spend time, even in a meditative state or just trying to understand my own body, it allows me to be able to, say, work with these embryological forces, because you have to come to this place of stillness. When I put my hands on someone's body, first and foremost, I'm not trying to sense what's going on in their body. First and foremost, I'm bringing myself to this place of stillness, trying to find my own health, the health that's in my own body, and synchronizing with it. Once I'm able to synchronize with my own health, then I may start to sense what's going on in someone else's body. So are we born with it? I think we're all born with it. It's just how we're able to develop it if we go into this type of profession. And that's where I say, when I'm working with someone, the goal these days is for that patient to start to find their own health so that they can learn how to use this therapeutically for themselves.
Okay, so when you're treating someone, you're first getting yourself present and still.
Yes.
Like when you talk, it sounds like you're getting to neutral. So you're neither adding nor subtracting.
That's being used. It is a neutral. I have to bring myself to this place of neutral, so that tell a little story that I like to say. It's almost like getting everyone to come to staff meeting, so to speak. And if you get everyone to come to that meeting, then everyone has to get quiet so that the meeting can begin. My musculoskeletal system, my nervous system, my endocrine system, my cardiovascular system, all of those systems have to come to that place of neutral, so that then they can become whole again, and they can start to remember their wholeness. So when I'm working, I bring myself to that place of stillness so that my system can become still, and so that the patient's or the client's system can have something to start to resonate with, or say, hey, I want to be like that. I want to remember my own stillness, or remember my health.
So is one of the core foundations that the system wants to be in a place of neutral, and you need to retrain it or reteach it or give an opportunity to show?
It's the system, or our bodies, we all say it's always seeking balance, or it's always seeking health. And so by receiving this type of work or doing this type of work, the body starts to remember its own health, because it's always there. Each one of the systems starts to slow down and remember those embryological fulcrum, or that embryological fluid body that it came from.
So, sorry.
Go ahead. And well, I was going to say, and by remembering that embryological body, it starts to heal itself.
So, how long does it usually take you to get to stillness?
I've gotten better.
Practice makes perfect.
I'll say I've gotten better because I live out in the natural world. We live where I live. We're surrounded by water and woods. So by being in the natural world and sensing that stillness that's outside in the natural world, I've gotten a lot better at bringing myself to that place of stillness. So at this point, I say I'm always sitting in stillness, and yet there are distractions. And if I'm in a room working with someone, it may take me 10 minutes or so to bring myself to stillness. And the beauty of this work is, over a period of time, I can go there without letting my ego get involved about, oh, I need to be doing something with someone. It is the hardest thing, well, it used to be the hardest thing for me to do, to not want to do some tissue work on someone. It took a better part of 10 years for me to be able to bring myself to this place where I put my hands on someone. I can sit there until I go to neutral, till their body goes to neutral. And at that neutral point, that's when the session begins. It's not the first 10 minutes of the treatment. It's 10 to 15 minutes in, as that's when the body starts to settle. The body has to settle.
What benefits do people notice from craniosacral therapy?
I think the first benefit that most people notice is that they're relaxed. You know, their whole cardiovascular system starts to down-regulate, so they start to feel not as tense or more settled in their bodies. Another one that they may start to sense is they feel the stillness around them. And so that's another benefit. They're able to start to find their breath and find a way to bring themselves to that place of stillness.
Does their pulse go down?
Some, I would say some. I've had people's pulse really settle, and I've had their whole nervous system start to down-regulate. So this work, it's working with, I would say, re-synchronizing the nervous system, or bringing that nervous system down to that neutral, and then the whole body starts to rebalance itself towards that neutral space.
So do you treat yourself, or you get treatments?
I get treatments, and I get treatments from my wife, Noelle. She treats me, and I get treatments. I get more massage treatments than I do cranial treatments, because I'm not around that many other practitioners that I know. When I go to trainings and stuff, I get treatments, but mostly I treat myself. I gave myself a really good treatment yesterday and the day before, because you will like this. I designed this star, and I hung it 60 feet in the air at the top of this tree in the middle of our property, so that everyone coming across the reservoir can see this star that's 60 feet up in the air. Well, I had to climb to the top of this spruce tree all the way 60 feet up. Sitting, I could see probably 2 miles around this whole reservoir, and I found a new place to sit and rest, and that's my new.
Because it's so convenient.
It's it's right there. I just climb up the tree, and I'm sitting in this huge bowl of this reservoir, and it's all still. And so that's my new place to go to find that place of stillness. I sat up there for about a half hour yesterday after it had snowed, and in the cold, 28 degrees, in stillness. And what I tend to do is find places like that. In this place now, when I bring myself to that place of stillness, I go to the reservoir and bring that stillness into the room.
So you bring it with you.
I take it everywhere I go. It's a great tool for people to be able to start to settle themselves, find a place that they really like, that's quiet and still, and wherever they go, take that place with them.
So what you're talking about sounds a lot like mindfulness and meditation.
Mm-hmm.
So are you doing mindfulness with your clients?
Yes. Generally, the mindfulness part at this point is happening at the end of the treatment. I may give a treatment, and then if I have time at the end of the session, I'll ask them what they experienced, and they start telling me a little bit about what they experienced, and I may explain that it is being able to sense, your body slowing down, or being able to sense the changes that's happening in the body. That is mindfulness. That is bringing yourself back into the present moment. And for me, that present moment is where we begin that healing process. If my thoughts are all somewhere else, it's kind of hard for me to settle myself. So being able to sense what's going on in my body, being able to sense my breath changing, that allows for my mind to start to settle, and that brings me more into the present moment.
Does this help with pain?
Yes. I found that it helps with pain quite often, because what's happening is the whole nervous system starts to regulate itself, the cardiovascular system starts to downregulate itself, and the pain receptors start to diminish. And so, yes, it does help with pain.
Sounds like it would help with digestion, too.
Yes, it does. I would say when we start to downregulate that nervous system, the whole vagus nerve and everything starts to allow for digestion to function a lot more effectively. I haven't found anything that this work does not benefit, because mostly what we're seeing is that by down-regulating the nervous system, the whole body starts to, and when I say down-regulating, bringing it to that place of neutral, bringing it to that place of stillness, the whole body starts to remember its own health.
You also teach, yes?
I teach continuing ed courses for other massage therapists, a neck and shoulder pain course, back pain course, and an introductory to craniosacral therapy, or we're calling it an introductory to mindfulness in craniosacral therapy. I find that I love doing this work so much that to be able to teach other therapists that have only had a basic training how to be mindful in their practice, what that does is that allows their practice to deepen instead of just going into pushing tissue. And some people really enjoy the tissue work, and others like myself, are looking for something else, and the cranial work is another avenue to help deepen their practice. And I would say this work has settled me over the years of practicing cranial work. I'm not as fearful. I don't get as anxious as I used to about most things. I'm able to stay present in the moment just from doing this practice over the years. And I find that when someone comes and receives a treatment, it allows them to start to sense that peace within themselves. And the more they can sense that peace within themselves, then the anxiety level starts to diminish.
This is valuable for a lot of people.
It's valuable for, I think, everyone.
Yeah.
I have not found anyone that has not benefited from treatment, from a cranial treatment in some way. It may take some people a lot longer to come to that place where they're settled within themselves.
Depends where you're starting, right?
Depends on where you're starting. If you spend a lot of time in the natural world, if you spend a lot of time outside in stillness, it probably doesn't take as long. If you're congested in the city, it may take you a lot more time to come to that place of stillness and rest.
Do you give people a homework ever?
Yes, and homework is so important. And most of the homework that I give people is to find their breath. You know, to be able to start to use their breath as a way of coming back into the present moment. I will have them take an inhalation, breathe it all the way out, and start to notice that stillness at the bottom of their breath right before they take another breath in. And if they can start to sense that stillness, and then I have them breathe it into their body. Maybe breathe it into their belly button, breathe it into the back of their heart, breathe it into their third eye, so to speak. All of those places have these deep embryological still points that allows the body to come back to that neutral. So the time that I tell everyone to do it is when you're lying in bed. Make it simple, make it easy.
Before you get up or before you go to sleep?
Before you go to sleep is in general, because most of us are all wound up. Or for those that wake up in the middle of the night, it's another really good practice to do is find your breath, breathe in, breathe all the way out, notice the stillness at the bottom of your breath, breathe that stillness in, notice the stillness at the top of your breath, breathe it out, and just really start to sense that stillness, working with that stillness at the bottom of your breath and at the top of your breath. That's most of the homework that I give people these days. I don't have them go out and exercise or anything, because I think a lot of people do a lot of exercising, and not all of us come to that place of stillness.
Okay. We're coming to the end of the time we have at this session. Is there anything that I missed asking you?
I think what I would say that's most important, or what allows me to do this work so well, is that I'm an organic farmer, and I spend a lot of time outside in the natural world, and it allows me to sense that stillness or watch it come over me. And so if people get a chance, if someone gets a chance to be outside in the natural world, it's really important, because I think as a culture we have what I call a nature deficit disorder. We don't spend enough time in the natural world. And so if you can get outside, see if you can start noticing the stillness that's in everything, that's underneath the wind blowing. We all know that there's that stillness in the eye of the hurricane. So being able to sense that stillness within ourselves, sensing that stillness outside in the natural world, will allow us to settle.
Thank you.
Thank you.
Thanks for joining us for another episode of Visions for Health. My guest today was Andrali Horn, deep tissue massage therapist and craniosacral therapist. Thank you.
Thank you.